If you took all the blood vessels in the human body and laid them end to end, your resulting blood vessel conga line would stretch over 60,000 miles. That's long enough to wrap around the Earth's equator 2.5 times. Amazing. Especially since every one of these blood vessels is necessary. They deliver much needed oxygen and nutrients to every organ in the body, including your eyes. Nutrients are delivered to the eye by way of tiny blood vessels located in the retina at the back of the eyeball. Unfortunately, these tiny blood vessels are easy to damage. One common source of this damage is diabetic retinopathy, which is a complication caused by uncontrolled diabetes that can sometimes lead to vision loss if left undetected and untreated.
What happens in diabetes is that chronically high sugars cause slow damage to the blood vessels in the eye and elsewhere in the body, particularly in the retina. And over time, the blood vessels lose their ability to stay competent. So what happens is you have fluid leaking from the blood vessels, the retina gets a very poor blood supply, and you can sprout abnormal vessels instead of the normal old vessels. You can have bleeding inside the eye, leakage of cholesterol-like material into the retina, and all these things can cause blurry vision, complete loss of vision, and eventually in severe cases you can even have what's called a tractional retinal detachment, which is from all the abnormal blood vessel growth, the retina is basically pulled off forcefully.
This damage happens slowly. Uncontrolled diabetes results in high glucose or sugar levels in the blood, which creates a pressure within the blood vessels that can be damaging to those vessels over time. Some patients may experience blurry or double vision, flashing lights, or dark empty spots in their vision, or trouble seeing things in their peripheral vision. But not all patients exhibit these symptoms. If left unchecked, these changes in the back of the eye can become severe enough to cause significant loss of vision. Couple these serious consequences with the fact that not all patients have symptoms, and we could potentially have a recipe for disaster. The saving grace? An ophthalmologist can easily detect the blood vessel damage during a routine eye exam.
It's important for diabetics to get screened regularly by their ophthalmologist, firstly because you can detect problems in the eye caused by the diabetes, and also because it can give the primary care doctors and the endocrinologists taking care of the patient a clue as to how much end organ involvement there is from the diabetes. It's recommended that every diabetic gets screened at least yearly to look for what's called diabetic retinopathy. When a diabetic comes in for a yearly screening, they get a full exam, which includes checking the lenses for any cataracts related to the diabetes. We do a thorough check of the retina, specifically looking for abnormal blood vessel growth, hemorrhages inside the retina, leakage of fluid into the macula, which is responsible for the central vision. If there's no problems, it's just a yearly screening, and we monitor it. And if there are problems, we follow it closely and treat when necessary.
There's even a way to increase the odds that your ophthalmologist won't find anything alarming during your eye exam, and that is controlling your diabetes. We mentioned that the blood vessel damage is the result of high glucose or sugar levels, but if you control your diabetes, if you keep your blood sugar levels low enough, the blood vessel damage and consequent vision loss should not occur.
The most important factor in preventing diabetic retinopathy is controlling the blood sugar. And that's true for most organ damage with diabetics. If you control the sugar, you're much less likely to have complications. But regular screenings are important because if you detect diabetic retinopathy, you can treat it, you can perform laser, and there are new medications that can help treat swelling of the macula from diabetes. You can prevent that abnormal growth of blood vessels and at least stabilize the vision and sometimes even reverse any vision loss that may have occurred previously.
Other important lifestyle choices that help control diabetes are following a healthy eating plan, being active for 30 minutes most days, don't smoke, and control your blood pressure and cholesterol, which really are things we should all be doing. And diabetic or not, you should always call a health professional immediately if you have vision problems or sudden loss of vision. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.